Thank you very much, Ross. I'm going to use PowerPoint, and I apologize for that if you're fed up with it, but it helps keep me right as much as anything. So what I'm going to talk about, I've called Some People Struggle Now More Than Ever, which was the title I gave to the first report I did, which was for North East Fife, which was commissioned by Sheena Watson. And Some People Struggle Now More Than Ever was a title that seemed to fit the research that was done for the whole of Fife following the North East Fife report. The research was commissioned by community teams. So although it covered a lot of the council services, it was very much done from the perspective of community learning and development. So I'll just tell you a little bit about the research before I tell you about the findings, just so you know what I'm talking about. And the sample in Fife, we had 154 people interviewed, and these were people who were vulnerable and disadvantaged. And the way of finding these people who are seldom heard was by finding people who used food banks and people who'd got crisis recovery grants from Fife Council. And so 154 is a very big sample for this kind of qualitative research. I also interviewed 35 third sector organizations, largely to find out that from their expertise about the local communities. These 35 different third sector organizations were some big ones like Fife Voluntary Action and some small ones like community councils in local villages. So there were organizations both large and small. And the sample was highly robust because the method that we used was narrative inquiry, which I'll come back to, which actually looks at people being individual case studies. So rather than looking at people across a spectrum, you look at individual case studies. So we were interested in trying to reach those who are seldom heard, those seeking support, those who are vulnerable, which is of course terribly difficult to define, and also those professionals who work with these people. So our sample included elderly people, young people, people living on their own, and people in families. So it was a good spread. And the thing that I think is most important to tell you is that people had complex and chaotic lives. So we looked across a wide range of services because people who had mental health issues also had housing issues, might have addiction issues, might have issues with children with ADHD, all sorts of complexity affected their lives. And we were looking at the past, the present, and the future. So we were asking them to look at the past of COVID, the present with COVID, and what they thought about the future. And their complex and chaotic lives meant that they felt very disempowered and were unable to see a future beyond COVID, and I'll come back to that. So narrative inquiry, for those of you who maybe haven't come across it before, is simply asking people to tell stories and tell stories about their life. It's a highly accessible form of inquiry in that people like to tell stories about their life. It's something we naturally do. So it was very accessible. And the other thing that was really important about narrative inquiry is that participants framed the agenda. So we didn't ask people about food insecurity. We didn't ask people about mental health and well-being. We asked them one question to start with, which was just tell me about the first time you heard about COVID. Then we prompted and probed and encouraged them to talk about what they thought was important. So they told us what was important without us framing the agenda. Having said that, we did that for about the first 20 minutes of the interview to let people tell us what they thought was uppermost in their mind. Then the second part of the interview was we asked people to cover the areas that they may not have covered so we could answer the questions that we had. So it was a two-part interview. And it took place in the second wave of COVID, which is very difficult to define, but people were just beginning to think about the vaccination. We're talking about a vaccination, but vaccinations hadn't started. And our community teams did the interviews. And this means that the CLD staff did the interviews, and they did them very well because we had people found it very cathartic to talk to us. They wanted to talk to us about their experience of COVID. And some people cried, some people laughed. it was very much enjoying getting over social isolation. We had one person, for example, who told us, and she told nobody before, about a debt she had of £30,000 that was causing her great distress from poverty. And she cried, and the community teams did really well knowing when to stop and when to ask people if they're able to go on. And it was really done particularly well by staff in Fife. So now I'll come to the findings. And the most important thing we found out that people talked about was their mental health and well-being. All felt it had been bad. They felt absolutely miserable and couldn't see the future. Poverty, food insecurity, debt, fuel poverty was the next finding. Poverty was really important underpinning things, and social isolation, being lonely for both rural and urban people. Rural people had social isolation from geography and all the other reasons, whereas urban people had no access to garden or safe space. So social isolation was really something that people talked about. And finally, the people talked about the need for community resilience and the need for communities to continue to support and to get better. So I'll talk first of all about the positive findings. And I'd encourage you, if you can get hold of a copy from, I think Ross will have a copy. The title of the report I did about the whole of Fife was "Fife Did Not Let Me Down When I Really Needed It." That's the title of the report about the whole of Fife. And so the positive findings were that people felt really supported by the council, the third sector, and community teams in particular. And the third finding was that people felt gratitude of what had been done, particularly for food. Of the people we interviewed, 154, only 3 had felt that their well-being hadn't been affected, and only 3 hadn't had to use a food bank, community pantry or larder. There was gratitude, particularly for food, but gratitude is one of these words that's kind of implies a bit of disempowerment. So I'm going to come back to the findings and talk first of all about mental health and well-being. And somebody said, I became a bit of a hermit. I barely left the house, got in a bad way, getting up late. That's just typical of the kind of thing people were experiencing. And throughout, the mental health and well-being is going to be a long-term issue. It was an issue for people who had chronic or acute mental health issues anyway, but it also was an issue for people who didn't have this history of mental health issues. So it's going to be long-term. And it's worth noting that in Tayside in particular, domestic violence has increased dramatically. And there needs to be a CLD plan for mental health and well-being, because the NHS can manage the chronic and acute mental health issues, but those other issues that are more to do with social isolation need a CLD approach. So I recommended that Fife urgently audit, in association with the NHS, reserves for mental health and well-being to plug the gaps where people might fall through. And the other thing that was identified was a need to source training for volunteers in how and where to signpost people, because volunteers felt very willing to support people, but didn't know where to signpost them to, because people were coming to food banks and wanting to talk about addiction issues, for example, and the volunteers didn't know where to signpost people. So that's something that became really important. The next thing I want to talk about is poverty. And Joseph Rowntree has produced a report this year on poverty in the UK. And they have a really good definition of it, which was poverty means not being able to heat your home, pay your rent, or buy the essentials for your children. It means waking up every day facing insecurity, uncertainty, and impossible decisions about money. It means facing marginalization and even discrimination because of your financial circumstances. The constant stress it causes can lead to problems that deprive people of the chance to play a full part in society. Now, I think that's a really good definition of poverty because it's very holistic and looks at the experience of people overall. And people spoke about financial issues unprompted. in our research. And Joseph Rowntree says that 1 in 5 people in the UK is currently experiencing poverty, which is an extraordinary number of people, and it just makes me very angry. And poverty was a new thing for some people that we interviewed because they'd just been furloughed or made unemployed. And it's really was a very big issue. So poverty was very much linked to food insecurity. So people said the government doesn't give you enough money to live on. I've got to survive on £20 a month. Or the kids are at home saying, I'm hungry, I'm hungry. Now, poverty is a national or global issue. It's not something that just the council can manage, but the council can do some things. So I recommended to Fife Council that they use the third sector as much as possible for food security, because they have the local ability to move quickly and manage things on the ground. And this is something that is really important, in that one food bank in Fife said it's after COVID, it had to increase its provision by 66%, and 1,400 meals in one day were given out by one Glenrothes food facility, and there's more than one facility in Glenrothes. And there were issues with people suffering poverty for children being at home and not being able to feed them. And fuel poverty was an issue, and transport was an issue, and these were linked to social isolation. So the problems all intermesh. And Marmot, who's a commentator who talks regularly about councils and poverty, said that if people are going to eat healthily, they need to, this is poor people, they need to spend 75% of their money on food, which leaves nothing for rent, nothing for anything else. So people can't, when they're suffering from poverty, eat healthily because the food is too expensive. So I want to talk also, in talking about poverty, briefly about dignity. And the Independent Working Group on Food Poverty came up with 4 dignity principles that people should use when providing food. And dignity was encapsulated by one person who said, I felt very awkward like a pauper using the food bank. Oh God, you're a nurse, you shouldn't be here. So she was a nurse employed using a food bank, and she felt real stigma. So people feel grateful yet resigned to using food banks. And when I interviewed the third sector, they said that community pantries can reduce dependency because they were worried about dependency, which troubled me a bit, because I felt, why are people worrying about people being dependent on more than one food bank or using them too often? But anyway, that aside, people did say that if people volunteer with community pantries, then that's going to help reduce dependency because they have an opportunity to give something back. And another thing that needs to be done in Fife is train providers to work with, not for people, because a lot of volunteers came forward with the pandemic, and a lot of them don't know about working with people, not for people. So we had volunteers whose attitude was not quite the way we might want it to be. They were saying they were doing good to people not as well off as themselves, things like that, and the working with people would be better. Now I come to social isolation, and people said things like, well, death, we were cheating every day. I was really worried about myself. I was by myself. I was spending 3 or 4 weeks at a time in the house. It was terrible, terrible. In lockdown, it's my mum and my dad and my little brother. No, I don't get on with my brother. I just hate him. I play my Xbox all day long. So both rural and urban, young people and elderly people felt completely phased by the pandemic and felt loneliness. And this is where things like adult learning and youth work to promote resilience come in. And resilience is about things like self-esteem, confidence, coping skills, healthy living, which is physical and emotional health, culture, arts, outdoor ed. And this is just so important because people sometimes think I'm being slightly superficial when I say arts are important during a pandemic, but gosh, they are, because people get peer support, they get enjoyment, and they get self-esteem and confidence from the arts and outdoor ed and things like that. And adult learning and youth work are absolutely vital to help people feel more resilient. So to summarize, those people at the margins have become more marginalized as a result of the pandemic. For example, those with multiple disabilities have lost their carers, have become more disadvantaged. Those at risk of domestic violence have been cooped up with partners that they might need relief from, and that's increased in Tayside, and I'm sure it will have done in Fife too. Those who are single parents may be doing 3 roles and have the stress of that, being a carer, say, for an elderly person or children, being a teacher for homeschooling, and also trying to hold a job down for an income. So those people are really stressed. And then finally, in Tayside, teachers report they're finding more should be looked after children. What they mean by that is children who are looked after, they know, but they found more who should be looked after as a result of the pandemic. That was reported by teachers in Tayside. So what we concluded from this was that community resilience was important. Some don't like to talk about community resilience because they think it's a way that governments have of blaming the community for not being resilient enough, for not coping. But I like to think of resilience as being more about robust communities, communities that are strong. And when I say robust, I always think of a nice strong coffee and this nice round notion of community robustness. And community resilience needs to operate at 3 levels. The individual and coping skills, that's the one-to-one, and CLD has an important part to play in the one-to-one. The community and peer support, that's important to resilience. And that's where we need to provide positive opportunities for people so they can feel more strong, feel more resilient, and feel more health and well-being. And then the 3rd level that people need to operate in CLD is systems and structures. That means being political, not with a capital P. I don't think local government employees need to be political because they're not allowed to be, but they can be political in the way that they assist people with political literacy. That means helping people to know how to get things done for themselves. So it's about empowerment. It's about helping people to know how to contact their local elected member, their MSP or their MP. It's helping people to know how they can make a difference themselves to their own lives. And we need to facilitate that. And finally, there's a need for resilience, for reflection. Because this crisis happened when it was a major panic and council and everybody leapt in and did things to help the crisis, which is absolutely crucial. And I'm not saying there's anything wrong with that, but now is the time to pause, take stock and reconsider. And this model, which comes from the Royal Society for the Arts, is a useful way because I think that the 3rd sector and the council need to be reflecting together. So the things that we can do is look at the things that we started as a result of COVID. Do we end them or do we amplify them? And things that were stopped as a result of COVID, are some worth letting go forever, or do we need to restart these? And this is a useful framework, which I think you'll have access to the slides and be able to see this. And I think this is a really important way that the 3rd sector and the council can work together. And then community development is absolutely crucial, because I've talked about adult learning and youth work, but community development is absolutely crucial. It's a process for collective action, and everything should we do, youth work, adult learning, and community capacity building should be embedded in community development. It needs to be longitudinal. We need to build trust, and that takes time. And we need to I recommended that Fife do refresher training for CLD staff in embedded practice in community development, because we need to do everything with the link to the community for this community robustness. We need to engender positive community experiences, which means those things like arts and festivals and things like that. We need to link people at the margins of communities. So that's the people I mentioned before, prioritizing elderly people, young people, singletons, those living in rural communities, all those people with disadvantage. And finally, we are the glue that holds communities together as CLD. That's what we need to do. So we have a choice, and everybody talks about the new normal and going back to it. There'll be pressure to go back. There'll be huge pressure to go back to what was, because traditionalists will want us to go back to what was. I was talking to some people in Tayside who were saying that people who were on furlough or were employees were now being put on contracts, self-employed, rather than being employees, with all the negatives that that implies in terms of 0 hours contracts. And so that's a trend that needs to be looked at. There's going to be increased possibility of increased austerity, which is going to be horrendous for all the people that we work with. So the positive way to think is, it is community choice, which we can facilitate, or our choice, what happens as a result in the new normal. And we need to be acting towards that. One of the things that I think we're very bad at is seeing the value and impact of our profession and how strong it is. Because I know it's really strong and powerful, but we work with individuals, groups, and whole communities. We work on issues identified, interpreted, and managed at the local level. We work at the local level on issues with national and global significance, like poverty. We work sustainably with both a short-term and long-term effect. We work with people at all levels of society. And we have important relationships with all those involved in our work in order to effect change that is in the interests of the target community and wider society. So that's what we do. And when you put it down like that, it makes you realize the importance of it. And I found that CLD staff in Fife were very good at operating at the local level, which is important, but didn't use their expertise to influence policy as much as they might. And I said that to the senior managers in Fife Council, that CLD staff should be operating more as policy levels with resilience and things like that. So one of my trusted colleagues says that we often tinker at the edges of poverty. And that's something we need to stop doing. We need to stop tinkering at the edges of poverty. If we care about poverty and think it matters, we need to do something. And I think there are 3 ways we can do that, which are very achievable. We can engage in political literacy. Political literacy is something we can do in adult learning and youth work and community development. We can help people learn how they can take control of their lives and the systems and affect the systems and structures that impact on them. We can show the impact of what we do, because we often find that we're not valued as much as we might be. So we need to be better at showing the impact of what we do. And the third thing we should do is work collaboratively so that we get support from others and support from managers to make change happen, to see if we can influence policy changes and make things change. So it's our choice. The pressure to go back to what it was with enhanced austerity is huge. We need to stop this. We need to help other people. So that's something I'd like to talk about. So my final words are about the research was finding out what people thought about their life as a result of COVID now, but they were too downtrodden and stressed and unhappy to think about the future. So a future is being planned without their input, and that's not good. We need to research. So research is something that I care about. So I think we should be researching the aspirations of the future, for the future of vulnerable and disadvantaged people in about 6 months. I think we should be doing that. So we can't, at now doing it, people weren't prepared to look beyond COVID. But as we start to come out of the major pandemic, we need to look at the aspirations and future for these people. And I think it's really important to notice that things weren't the same in all areas of Fife. So I found differences in different areas. And for example, people in Kirkcaldy were very angry about COVID. People in Cowdenbeath area were very positive and could see a light at the end of the tunnel. People in Leavenmouth in the rural villages felt stronger than people in urban areas, towns. And it's very interesting that Northeast Fife, the poverty was very hidden. It was very much not talked about, but it was there. So we need to research what contributes to one disadvantaged community being more resilient than others in Fife. There are psychological, social, geographical, cultural, and I would add historical reasons why this is the case. So perhaps my final word is that 90% of health determinants, what makes people healthy and have good well-being, is socioeconomic, not health related, not physical health related. And that relates to people's likely mortality. So we need to be very, very strong about well-being and socioeconomic status. So I was asked to set questions for your discussion groups, and I'm not sure you'll get through to all of the questions, but what I wanted to ask you to think about is, what are your priorities for building robust communities at the 3 levels, the individual, one-to-one, the community, and systems and structures? And can you facilitate partnership reflection at a local level? Is that something that falls within your remit? And then finally, the most important question, how can you help achieve the community's choice of future post-pandemic, the new normal?